Assalamu alaikum wa rahmatullah. I'm very grateful to Dr. Mavish that she provided me this opportunity to talk to you. I wish I could come there physically, but I had an overseas commitment, and this is why I was unable to just be with you. But thanks to technology, we can just talk to each other even if we are not physically together. I'm a surgeon. I did my FCPS from Pakistan, FRCS from UK, and had a fellowship from Australia as well in hepatobiliary surgery. And I retired as principal in Qaid Azam Medical College. And I also did masters in medical education, and I've been actively involved in medical education. So this has been my more than 3 decades career in health professional. But fairly recently, I realized that artificial intelligence is coming to us like a bullet train, and it is going to revolutionize not only the professions related to tech, but even very simple professions like a shopkeeping, like a retail store, like a construction company, it like a pharmaceutical business. It is going to affect them as well. In fact, it is going to affect the housewives as well. So how a medical profession can be spared of it, and realizing that. And in fact, I started this journey when actually artificial intelligence was not very actively being pursued in healthcare for about 5 6 years before. And then I realized that every doctor must learn artificial intelligence. There is at least must learn what is the role of artificial intelligence in healthcare. This requires a long discussion. This also requires that not only a health professional has to be here, but data scientist and artificial intelligence expert has to be there to make us understand the technical details of it. But in this short message and short talk with you, I would like to just introduce to you that what are various potentials and what are the future of healthcare in the era of artificial intelligence, because this is the right time to step into it. There was a time when we used to do gallbladder surgery, then laparoscopic surgery started, and there was an opposition to it. I remember when I started in 1994, even some of our seniors, they were very against it, and they said no. If we can just make a small incision like this, and we can take a gallbladder, why to make 3 holes and blah blah blah. But now people from villages, they come and they ask from us, will you do it through camera or will you not do it through the camera? And I just foresee it that after some time, our I'm using clients in a business terminology, our patients, they will come to us and they will ask, do you use artificial intelligence in your diagnostics and your evaluation procedure or not? And this time is not very far. So with this introduction, I would like to just in next 5 to 10 minutes, I would like to just share with you what are the basics of it. See, what is and I will be at very basic level. What is an intelligence? Intelligence is an ability where we get the data and then we analyze that data on the basis of our past experience, then we extrapolate it into future, and then we make a solution. So intelligence is an ability to solve the problems. And how we solve it, I have just mentioned that. This is what we do on a daily basis. And this is how human intelligence works. Now, artificial intelligence is actually a software. It is actually, just imagine that just like our brain, it is an other artificial brain. This brain is fed by data. Data is the most important and crucial thing for artificial intelligence. If data does not exist, then this artificial intelligence is just useless, is nothing. So there was time when we did not have much data, but now in every walk of life, there is tremendous data which is available at Google headquarters. Each and everyone who has a Google account, there is a file for that person. And Google actually knows us, what time I wake up, what time I sleep, what I eat, where I go, who are my friends, what are my favorite things to do, what books I read, and so on and so forth. And this is not a joke. Now, this data now has such a huge mammoth data, structured data available in the cyber world, that this artificial brain, which I've said artificial, I'm actually symbolically actually telling you, I'm creating a parable. Now, just imagine a brain is there on this side. Now, this brain has got data, and this data is of all the human brains starting from 70,000 years ago till to date. And this data is present in this brain. And then this brain is technically called a model, and that this model is trained on that data. Now, whenever we give it to a stimulus, and this stimulus initially on a computer used to be something which you type on it, but now it is efficient enough that it can take a verbal data, it can take a data which is in the form of a text, it can get a data which is in the form of a visual, it can, after some time, not today, after some time, it may just get a data which is like touch sensations. And when this data or a query is given to it, now only one thing was left, that how it can over project it and can think into future. This was not possible till this brain developed another power which is called computing power. And now with Microsoft, which leads to in this field, it has got a tremendous computing power. And there is one thing which is just on the edge to come into the market, and that is called supercomputing. When supercomputer will come, then this has got a computing power which is million times more faster than the human brain. Human brain is a magic. Human brain has got a miraculous potentials, tendencies, power, but this will have thousands to millions times more quick computing power. Now you just imagine, you know everything which is written in every book on every topic ever published in the world, and your brain is capable of analyzing it and making conclusion out of it within seconds. How smart you will be. That is what artificial intelligence is going to be. And the things which they produce will be algorithms, and these algorithms will have such a tremendous power that it will influence the human life very rapidly. When computer was invented, they said after 30 years this world will be different. Now with artificial intelligence, you can say with confidence that after 5 years this world will be very different. Now, this is a background of it and its implementation in various walks of life. In healthcare, how it is going to affect. See, in healthcare, if we know how to create a structured data, and that structured data, if we just put it into a model, this can help us. I'll just enlist them. It can help us, number one, on making whole planning as an individual practitioner to an organizational body, the pattern of the patients coming to us, the timing of the patient coming to us, the pattern of diseases which are there. As a result, we can actually formulate our whole routine according to the need, which will be very efficient. Number two, it has got a tremendous potential that the work before the decision which a clinician does. Normally what we do, a patient comes to us, we just greet them, we take history, we do complete evaluation, we ask questions, we make a cross questions, we make a differential diagnosis, we make a working diagnosis, we try to find out the possible investigations which are required. what we want to decide, what procedures we may need to rule out it or to confirm it. This whole thing can be done by machine more efficiently as compared to us. Number 3, diagnostics. For example, an X-ray, for example, a CT scan, for example, an MRI. Our eyes, when we report it, a senior radiologist, a competent radiologist, when reports it, he can see the difference between white and black and the shades of gray, and according to that, he decides whether this is a stone, whether it is a fluid, whether it's a tumor, whether it is, attached to the nerve, whether it is engulfing an organ, basis on our distinguishing ability of various shades of gray. So it has been proved that a machine with artificial intelligence has at least many thousand times more ability to differentiate between minor differences of the shades of gray. So if a mammogram is being interpreted by a senior radiologist, a machine can interpret it much, much more accurately. And a person may be tired, a person may be biased, a person may have some other physical inabilities, his availability may be an issue, but this machine can work 24/7. It does not get tired, it does not get bored, it does not have a bias. So this is just an example. In histopathology, tremendous potential. In radiology, tremendous potential, and many more. Number 4, we can there's a very important correlation between pharmaceutical companies, pharmaceutical business and companies, and pharmaceutical organizations and healthcare. Now, for a big organization, the artificial intelligence can just warn us, can let you know about supply chain, about the inventory, about the expenditure which we spend on the healthcare, and how we can regulate it, right? So these are some of the examples. And with this, as we speak, we own, when I say we, I mean a company with which I give a consultation, a program which has been tested at least 1,000 times with very senior consultants of all the faculty of different specialities, where a person with average communication ability comes to that machine and can actually type it or can speak it, and can speak in any language, at least 78 languages of the world, Urdu inclusive, and can talk to it. And this software can tell them exact plan, which we, after a lot of exercise, we do it. And then the final word is that goes to a doctor, and then doctor evaluating it proceeds forward. So these are some of the examples, but I know in that short period of the time, it's not possible to really explore it completely. Now, see, the data scientists have got the ability, the coders, they have got the ability, but they cannot do anything in healthcare unless until we as a doctors don't understand them and just ask them the questions which are the queries on the basis of which they will solve our problems. So I told you that artificial intelligence is a bullet train, and it is coming. It is up to us to be in the train, or you may say be outside the train. No, the sentence is not like this. Sentence will not complete like this. You are either in the train or you are on the track. That's all I had to share with you. Inshallah, in some other times, with Dr. Mavish, we are planning that we will have a formal workshops, and we'll see what else can be done for our doctors as far as training in healthcare and artificial intelligence is concerned. Thank you very much for having me, and I really apologize that I was not physically present here, but inshallah, we'll see you soon.